Hello everyone, my name is Gracie Matthew. Today I will be presenting on the topic Scope of Practice in Acute Care Settings, Adult Gerontology Acute Care Nurse Practitioner versus Family Nurse Practitioner. Understanding the differences in nurse practitioners' role is critical for patient safety and workforce efficiency. In this presentation, we will compare the scope of practice for adult gerontology acute care nurse practitioners versus family nurse practitioners, examine the challenges created by role overlap, and discuss leadership driven solutions. By the end, you will gain insight into policy, education, and workforce strategies that support safe, effective, and collaborative care. Adult gerontology, acute care nurse practitioners, and family nurse practitioners both practicing in acute care settings, but their training and scope differ significantly. Overlapping roles can cause confusion, regulatory issues, and patient safety risk. Leadership decisions play a key role in clarifying responsibilities and improving outcomes. Today, I will explore evidence based strategies to align NP practice with their education and certification, enhancing care quality and workforce clarity. Adult gerontology acute care nurse practitioners are trained to manage complex, unstable, or critically ill adult patients, primarily in hospital or ICU settings. Family nurse practitioners are educated to provide primary care and health promotions across the lifespan, mostly in outpatient settings. Workforce shortage have led many hospitals to hire FNPs into acute care roles, which can exceed their formal training. State to state regulatory differences add another layer of complexity, creating inconsistencies for both employers and practitioners. The core problem is that unclear role boundaries create risk for patient safety and professional liability. Hospital may assign acutely ill patients to FNPs without proper training, which can affect outcomes. This lack of standardization also undermines interprofessional collaborations and may reduce staff confidence in team roles. As future nurse leaders, it is our responsibility to advocate for clear role delineation, standardized credentialing, and policies that align practice with the education and competency. This challenge presents a significant opportunity for leadership at multiple levels organizational, state, and national. Nurse leaders can establish credentialing standards that match the NB's training to their clinical responsibilities. Promoting interpersonal education ensures all team members understand each other's scope of practice, enhancing collaboration. Aligning staffing policies with the scope not only improves patient safety and outcome but also reduce liability, increase cost effectiveness, and improves workforce satisfaction. Leadership can influence policy and culture to ensure sustainable change across the healthcare system. Our SWOT analysis highlights internal and external factors affecting NP scope alignment. Strengths include highly skilled, evidence based clinicians and collaborative teams that improve patients' outcome. Weakness involve role confusion, inconsistent regulations, and limited acute care training for FNPs. Opportunities exist for leadership to standardize NP roles, develop policy and educational initiatives, and create bridge program for family nurse practitioners entering acute care. I recommend implementing mandatory role alignment policies in hospitals to ensure proper assignment of responsibilities. Adult gerontology acute care nurse practitioner certifications should be required for practitioners caring for acutely ill adult populations. 4. Family nurse practitioners interested in acute care, structured transition to practice program and bridge programs should be developed to ensure safe, competent care. Finally, advocating for state level uniformity in nurse practitioner scope of practice laws can reduce confusion and improve patient safety nationwide. These strategies protect patients, support the workforce, and strengthen the NP role in acute care. Implementing these recommendations does require investment. Training and credentialing programs can cost between $2,000 and $4,000 per NP. Transition to practice initiatives cost around $1,500 per NP annually. However, these upfront costs are offset by substantial savings from reduced errors, fewer readmissions, and improved patients' outcomes, which can total $50,000 to $100,000 per facility per year. Improved retention and staff satisfaction reduce turnover costs and ensure a stable, skilled workforce. Ultimately, investing in proper role alignment is both financially and clinically beneficial. Adult gerontology acute care nurse practitioners can serve as leaders and mentors for new and transitioning NPs. They can promote shared governance structures, giving nurses a voice in organizational decision making. Leadership roles in policy and credentialing committees ensure alignment with the standards and regulatory compliance. Fostering interpersonal collaborations improve patient outcomes, reduces errors, and create a culture of safety. Aligning the scope of practice between adult gerontology, acute care nurse practitioners, and family nurse practitioners is essential for safe, high quality patient care. Nurse leaders play a critical role in establishing clear policies, evidence based staffing, and ongoing education for practitioners transitioning to new roles. Future directions should focus on standardizing scope of practice, continuous training, and promoting collaborations across disciplines. By leading these efforts, we strengthen the nurse practitioner's profession and improve outcomes for the patients and communities we serve. Thank you for your attention. The references listed reflect current evidence on nurse practitioner roles, regulatory standards, and leadership strategies. These sources provide guidance on aligning practice with education, ensuring patient safety, and supporting workforce development. They include peer reviewed articles, professional guidelines, and evidence based policy recommendations. I encourage you to explore these references to deepen your understanding of NP scope, leadership implications, and strategies for safe and effective care. Thank you.